What's up, y'all? It's Ebony, your wonderful patient care technician for hemodialysis. I just want to talk about 5 reasons why the floor of hemodialysis may or may not, I don't know, be for you. One is fast-paced environment. If you are not a person that likes fast-paced environments, especially one that involves someone's livelihood, then you do not want to do this job. This job can be fast-paced, and it can go from 0 to 100 real quick. It can go fast-paced as far as you having to, put on patients in a timely manner. Fast-paced as far as you making sure that when you cannulate, or stick a patient with the needle, that you are doing it efficiently to make sure that it's in the right spot and that it is not burning or stinging or hurting them, infiltrating them. Like, fast-paced environment, a lot can go wrong, but a lot can go right. But I'm just saying, this job may or may not be for you. If that is the case, if you do not like fast-paced environment, if you need something chill, or you need to calm down and you need to sit, get you a desk job, you can get your desk job with the same companies, okay? These companies have desk job opportunities, okay? Or a hybrid where, you're going to be at the desk, but you're going to be working with this patient doing this. Like, there's different things you can do, but I'm just saying, don't become a patient care technician or don't apply for the job if you do not a fast-paced environment, as my paper says, that involves people's livelihoods, because you're talking about time livelihood, you're talking about their body livelihood, especially during what we love to call changeover, which is when you are turning over your chairs. Just like if you worked in a restaurant, you may understand this better, but even if you haven't, like, you turning over the chair to the next patient that's coming. All right, so I might have said this already, but number 2, if you don't like a high stress environment, changeover is when I endure or embark upon the most stress, because it's so fast and it's multitasking going on, and it's, again, someone's life literally in your hands. So let's say, for instance, during changeover, you can be rinsing back one patient while another patient next to or a couple seats down might get sick and be throwing up. You just never know. Or they could be bleeding from their side, or they could be a patient that has dementia and they could be picking at their access. There are so many things. So if you don't like a high stress environment, and some of this high stress is compacted in a period of time. So changeover is not for the whole day. Changeover is typically either I'm gonna stick to that. Changeover can happen in a span from, let's see, sometimes at my clinic it starts around 8:45 and doesn't end, depending on which pod you're in, until 2 o'clock. 9, 10, 11, 12, 1, 2. That about 4 to 6 hours. That's what I'm gonna give or take. That you are on your feet and you are going, okay? You might have like a little bit of time, maybe 30 minutes, maybe, to like sit down, but you're not sitting to just sit. You're sitting to gather yourself to handle the next task that will come whether you want it to or not. It's coming, okay? That patient is coming through that door. They don't know what you went through. They don't care what you went through. They don't care that the patient before them almost bled out. They don't care that the patient before them machine clotted and you had to restring it. They don't care that you had to retest your machine. You tested your machine 5 times and you just couldn't get it up, so you had to go grab another one, so that put you behind. They do not care. They care about, my time said 9:30. My time said, let's say if you having machine problems early in the morning, my time said 6 o'clock. And that's what time I'm supposed to be on. What's the problem? And I really don't even care about what the problem is, because my time, this is not nothing against patients, but because it's about patient care, but sometimes they can be very inconsiderate of the staff because they're thinking about, from my understanding, I feel like they're thinking about what they're going through, which is a lot in itself. But I often say that dialysis is hard on staff as well as patients. This is where the third one is, if you don't like people, being a patient care technician for hemodialysis is not for you. You are literally dealing with people. Excuse any background noise you hear. For whatever reason, my dog decided this is the time to chew her bone very loudly. So that's what it is. Anyways, if you don't like people, because people can be very temperamental. I'm a woman, cycle time be real. So, or not, catch me a changeover, it gets rough. So it just depends. Like, if you don't like people, if you don't like to talk to people, if you don't like to greet people, if you don't like to hear people's complaints, if you don't like to work with people, like if you're a person that works better alone, this can be a good job for you because you're going to work in your pod technically by yourself. But let's say when it's time to go to break, well, you need to let your babe partner know what if there's anything that's happened, any discrepancies or anything that's happened with any of your patients during that treatment, so that when you go on break, if something happened, they be like, oh, they did tell me that their blood pressure was a little low, so I need to watch them, like stuff like that. This job may or may not be for you if you don't like needles, you don't like blood, if you don't like bodily secretions, and I'm gonna put vomit on there, it's included. I personally do not like vomit. I do not like vomit. But that does not mean that I will not clean up a patient that has vomited. That does not mean that I will not help them. It just means that while that's happening, my stomach is turning as well. It's like vomit is kind of like, to me, the ripple effect of like yawning. Like once you see one person yawn or if someone yawns and you yawn, like, whoo, boy, the smell, I can deal with blood all day. I can deal with contaminated blood all day. But vomit? I'm gonna tell y'all a story. This is just how, and it's still in my head, it's still in there. So I had a patient, they was taking, she's a catheter patient, so the nurse was dealing with her. Well, she's throwing up. Mind you, she didn't have her mask on all the way. Throw up was coming down like a fountain out of her mouth, just like a waterfall. I'm calling it like a waterfall because that's how it was coming out. And she's like, Eboni. I turn around, I was like, bruh. I was like, oh my gosh. Immediately, I know I had to help, but immediately I'm like, get yourself together. Oh, the visual, is still there. So strong. I like needles. Sticking people. I can deal with blood. I can deal with certain bodily excretions, preferably blood. I prefer blood, okay? Anyways, if you don't like any of those things, you gotta at least like most of them because you're gonna deal with it. But if you don't like any of those things, or if you're one of those people that pass out when you see your own blood, or don't apply, okay? Don't do it to yourself. And last, certainly not least, probably not the last, but it's gonna be the last for this video. If you don't like to wake up early, do not apply for this job. This is one of those jobs where, let's say, finish training, and it is time for you to learn how to open and close the clinic. Once you learn how to open, or period, I say need to be to work, depending on the clinic, by 5 o'clock. And the way my clinic is set up, sometimes when the first patient gets on, you need to be there by 4:45 at the latest. 4:30 earliest, 4:45 at the latest. Some clinics be tripping because of tap or because, don't want to pay you for that extra, but that extra gonna help you out. Extra time, that is, because it gives you enough time to set up for your patients that are coming in, whether you like it or not, whether you want it or not. So yeah, if you don't like to wake up early, I say that like I was late this week. I was so tired. I'm still tired, but I was so tired. I ended up being late because I overslept. And the funny thing is I usually set like 5 or 10 alarms, like for real. And I did not. I looked at my phone when I woke up and I was like, dang, I only had one alarm set. I only had one alarm set for 3 in the morning. So I remember that alarm going off possibly, and I might have pressed that snooze button because that's what I be doing, and roll back over. And it wasn't until I heard the birds chirping a little bit outside, I was like, we're supposed to be at work right now because the birds is way too loud. That means that I don't even know what time it is. Honestly, I thought it was like 8, but it was only 5:57 a.m. And check my phone. Manager texted me like, I just scheduled. I was like, oh my God, I'm coming. I'll be there. Got there by 6:30 because but I was still half asleep, but I had to get myself up. Anyways, yeah, if you don't like waking up early, which honestly I don't mind waking up early, and I think it's just because it comes with the territory and it just comes with the job, because some people complain about this with patients that run for 4 hours, 4.5 hours, or whatever. Like, I don't mind getting there early because that means that I get there at the latest. If I open, I get there by 4. If I close, I get there by 5. And that means that I get to go home because we only have 2 shifts. So I get to go home between the hours of like 4 and 6. That's fine. Versus being there all day long. Now, some clinics do have a 3rd shift, so they are open from like 4 in the morning to like 10 at night. That's not our case, but I'm just saying, if you don't like to wake up early, if you're not a morning person, it's some people that's not morning people. I've dealt with them, and I told them, I was like, I didn't do it. Good morning, because when I'm up in the morning, when I come through those doors, I'm like, good morning, like, or I mean, I might not be that just yet at the 4 in the morning, but once we hit by 8 o'clock, unless somebody say something funny, I'm gonna laugh, or I might say something funny. You know, you just never know. So yeah, those are my 5. This job may or may not be for you. That's it. So y'all let me know, for those that's in the industry, did any of this resonate? And if you have any more to add, this job may or may not be for you. And I say may or may not be for you because some people, this may be okay with them. High-paced environment, high-stress environment, like people, like needles and blood and stuff, like to wake up early. That could be for you. That's for me. And I said that because that is for me more than when I was working for the billing department and sitting at a desk for 8 hours straight. That is not for me. That is not my ministry. Okay? So it can get crazy, but that fast-paced environment is currently for me. So yeah, so I look forward to hearing what you guys have to say in the comments about out of these 5, which one is for you or not for you. Talk to you guys later. Bye.